Okay, folks, let's take a look at a couple of the arguments on healthcare justice. We'll look at Norman Daniels' argument as well as Buchanan's argument. So let's start with Daniels. In Daniels' piece, is there a right to healthcare? And if so, what does that right encompass? Daniels' claim is that people have a positive right to adequate healthcare. So we'll see how he makes his argument and whether he gives sufficient evidence to support this claim. The legal right to health care is actually something that's available in most industrialized and developed countries in the world. The US, however, at least arguably until the Affordable Care Act went into effect, being the exception to this legal right. In most developed countries, there is a legal institution that guarantees people access to basic health care coverage regardless of their ability to pay. There are different ways to instantiate this legal right to healthcare. Places like the UK, where the healthcare system is a national healthcare system. In Canada, you have a public healthcare system. And in Germany, you have a private healthcare system. But in each of these, any medically necessary service is guaranteed regardless of someone's ability to pay. And this includes things like preventive care, rehabilitation, and some mental health care as well. In the US, however, poor and lower middle class people have no coverage and therefore no access to health care, except access to the ER, which of course ends up being more expensive for taxpayers in the long run. Something that's important to not only Daniel's argument, but discussions generally about a right to health care or other arguments for minimum basic coverage, like we'll see from Buchanan, will rely on a distinction between positive and negative rights. Negative rights are rights to not be interfered with. So we understand a negative right to be something like, we have the right not to be killed. We have the right not to breathe in polluted air. Environmental pollution undermines our right by interfering with our healthy functioning. So a negative right doesn't mean bad. It means it's a right that we have to not be interfered with by others. Whereas a positive right is a right to help from other people. So for example, a right to health care means that society has a duty or an obligation to allocate at least some of its resources to the health needs of its people. And on Daniel's view, people have a right to a fair share of these services, in the same way that people have a right to education. So a positive right means we have a right to something, and others have a duty to help provide that thing, whereas a negative right means that we have the right not to be interfered with. Libertarians will argue against positive rights. They are merely focused on negative rights. Libertarians' position on most issues is that the government should not interfere with their rights to freedom. They should have the choice concerning what they do with their lives, what they do with their wealth, their income, their opportunities, and so on. In fact, that negative right not to be interfered with overrides any possible positive right, even when it comes to things like healthcare. So for the libertarians, they're going to say, don't coerce people into providing resources or skills that they don't want to provide. Simply stay out of our way and let us choose. We choose what to do with our time. We choose what to do with our money. They don't deny that there might be something like a moral obligation to be beneficent, but it's an imperfect moral duty, meaning that it's up to me to decide, to choose when to be charitable, when to help other people. I'll be charitable if and when I want to. On the libertarian perspective, there is absolutely no positive right to healthcare. A right to healthcare, moreover, would be a bottomless pit because needs are unlimited while resources are limited. So ultimately, the libertarian view is that we want a minimal government that doesn't interfere with liberty. So the focus is strictly on negative freedoms. And there is no focus on the need for positive freedoms. For utilitarians, on the other hand, there is a focus on positive rights, but this looks a little bit differently than it does for egalitarians. For utilitarians, things like curing disease or preventing suffering increase the overall good of a society, not only in terms of health, but also in terms of things like national defense and security, as well as building strong community bonds. So the issue for utilitarians is the scope to rights of healthcare, especially in thinking about things like elective procedures, expensive procedures, long-term care, and so on and so forth. So for the utilitarians, as should be familiar by now, it's purely based on a cost-benefit analysis. Recall from the chapter overview the utilitarian approach for making decisions about how to allocate resources in particular situations, the QALY model. The QALY model is strictly a cost-benefit analysis for how to make decisions. However, this model doesn't consider concerns about certain things like how to prioritize sicker patients. But on the plus side of the utilitarian approach, it does focus on positive rights. There can, in fact, be limits on the entitlements or rights that people have to healthcare services, contra the libertarian claim that it's a bottomless pit. It doesn't have to be a bottomless pit. Decisions about which entitlements or which services are required simply show the need for a system that promotes the overall good for that system. The egalitarian approach is based on justice. And for Daniels, he bases his argument on Rawls's justice as fairness, which protects the equality of opportunity. There absolutely is a positive right to healthcare from the egalitarian perspective. And we'll see just how Daniels makes this argument. Daniels claims that illness or injury restricts the range of opportunities that are open to an individual. And based on a theory of justice, normal functioning individuals should have access to equal opportunity. And normal functioning includes emotional, cognitive, as well as physical capabilities. Thus, healthcare preserves our normal range of opportunities. So because being healthy is fundamental to our having an equal opportunity at life, Daniels is arguing that the principle of justice demands that we offer basic minimum health care, ensuring people's right to equal opportunities. Now, there are limits to equal opportunity due to the distribution of wealth, due to education, due to the availability of technology, and concerns for equality have to be reconciled further with considerations of liberty and efficiency. Though it is an egalitarian approach, we can't throw negative rights out the window, we can't throw utility out the window. These affect the limits of equal opportunity. So in a given system, we have to reconcile freedoms and liberties along with cost-benefit analyses in order to provide some kind of basic minimum tier of health services so that people have access to equal opportunities. Daniels claims that rights equal to opportunity are violated only if unfair social practices or preventable or curable diseases or disabilities interfere with the pursuit of reasonable plans of life. So inequalities in outcomes is legitimate so long as the equalities in opportunity are ensured. And this is in alignment with Rawls's theory of justice that we looked at the beginning of the semester. So for Daniels, equal opportunity takes the maintenance of normal functioning to be a reasonable limit to the positive right of healthcare. Yet still we have to ask, precisely what does a right to healthcare include? Well, equality of opportunity limits the rights to resources while emphasizing the importance of the positive right. People are wronged if the social obligation of a system of healthcare is not met. So denying access for any reason, like discrimination or ability to pay, is wrong and unjust. Denying access to certain kinds of services like mental health or long-term care is unjust. Everyone has a right to a basic tier of services available to protect normal functioning. So not all medical needs are entitlements. The scope and limits are relative to the facts of a given system, which include availability of technology, availability of physicians, and other resources. So one way to think about this is that people are entitled to specific services only if the system can provide it to everyone. The system should provide what is needed to appropriately protect equality of opportunity. And like the utilitarian approach, entitlements are system relative, though not based on utility, in this case based on equality. So rather than do a cost-benefit analysis, we do an analysis of equality of access. There are, however, some hard cases, including questions about entitlements for reproductive health, for abortion, for growth hormone treatment, for certain mental health issues. There are going to be difficult cases that will have to be worked out whether or not people have a right as part of a basic minimum to ensure equality of opportunity. In thinking about positive rights to healthcare and the limits on those rights, we have to acknowledge that not all needs are equally important. A need with little impact on opportunities for normal functioning is going to be less important than a need that has greater impact on opportunities for normal functioning. Still, there are going to be conflicts with respect to specific questions that arise in terms of how to distribute resources fairly, despite our having a principle of justice to apply. For example, we have to ask in certain situations whether to invest in some technology like a new MRI machine or an fMRI machine to detect injuries, illnesses, brain function, or should we invest resources in developing a new drug to treat some kind of mental illness or HIV. We might have to make a decision whether to invest in something that helps many people or something that helps fewer people but in a more significant way. But Daniels suggests that any choices that are made by fair decision-making procedures can be used to resolve these kinds of moral conflicts over the specifics of entitlement in a given system. Finally, Daniels addresses the question of how equal rights have to be. He asks whether equality implies sameness of treatment, whether a tiered system constitutes equality, and Daniels' position here is that a tiered system is compatible, but it's not required for providing equal rights to healthcare. What is required is a basic tier that promotes normal functioning and protects equality of opportunity. So these should be reasonably limited, since other things like education, national defense, job training, and so on are also required for equal opportunity for normal functioning. Further, Daniels concedes that some people do have more money, and they should be able to exercise their right to purchase additional services, or safer cars, or private education, or security systems for their homes. But we still need to provide some kind of basic level of adequate health care to ensure equal opportunity for normal functioning. Some will object that allowing another tier will undermine the basic tier. So physicians will only want to work for people who can pay more. Technology and research will only happen at the second or third tier. But the argument here is that there has to be priority given socially to the basic tier. Then, if other tiers can be added to avoid limits to liberty, they should be allowed. But the role of government is, in fact, to ensure the stability of a basic right to health care. And this is Daniels' argument. Okay, let's take a look at Buchanan's piece and see what he thinks. So in Buchanan's piece, The Right to a Decent Minimum of Health Care, we're going to see a different kind of argument for access to basic healthcare services. Buchanan's thesis is, Having a right to health care does not mandate minimum access policy, but other arguments do establish the need for a decent minimum. Buchanan is arguing for a decent minimum, but he's saying we shouldn't make that argument based on rights. It's not a very convincing argument. Buchanan notes that the two primary questions in the healthcare debate are the following. First, is there a right to a decent minimum? This is one question that a lot of people are talking about, a lot of folks are making arguments for. And second, what comprises a decent minimum of healthcare? And this second question depends upon the first. That is, how we answer the second question depends upon how we answer the first question. So what does it mean to say that someone has a right to something? We looked at the distinction between positive and negative rights in Daniels' piece, but Buchanan is asking us to think more about simply what does it mean to have a right to something? What does it mean to have a positive right? To say that Bob, for example, has a right to X is to say that X is due to Bob, that Bob is entitled to that thing. So this goes beyond saying that X is desirable, or even that it would be morally good if Bob were granted X. It even goes beyond the claim that Bob ought to be granted X. Valid rights claims, things like human rights, can be backed by sanctions of an appropriate authority. So the state can coercively enforce rights. This is arguably the role of the United Nations to ensure human rights. Yet, Buchanan's going to show that enforcing a decent minimum need not be based on claims to rights. Need not be based on claims to universal rights to health care. Why does Buchanan make this claim? He thinks that rights claims are too strong to back up. It's morally good, yes, to provide a basic minimum of health care, but it is not an entitlement guaranteed by society. That is, we can't say that Bob has a right to health care. We can't say that health care is due to Bob, that Bob is entitled to health care. Talk of rights is very strong. For example, valid rights claims always trump utility. If we claim that Bob has a right to something, that means that it doesn't matter what a society can provide. It doesn't matter if there are other things that we would normally think would trump Bob's right to that based on utility. A right means Bob is entitled to that thing no matter what. So in Buchanan's view, the rights argument is too strong of a claim that can't be backed up. However, Buchanan does think that there is something attractive about establishing a decent minimum of healthcare coverage. First, rights to a decent minimum are understood in a society relative sense. And this is the same with other rights or goods, such as education, for example. Particular access to a certain system of education is relative to the society that education is being offered in. So it depends on the social conditions of a given society. And this implies, too, that as the conditions of a society improve, so should the basic minimums. Another attraction of a decent minimum is that it avoids strong equality claims. Claims with a strong equal access principle that encourage talk of rights and entitlements can be left behind while still acknowledging the universality required for a decent minimum. It is difficult to justify equality as same access across the board, yet a decent minimum acknowledges fair basic access for everyone. And finally, since a decent minimum avoids strong equal access rights, it's limited to the most basic services that are adequate for a reasonably tolerable life. So what is the supporting theory here? Well, rights to a decent minimum is theoretically inadequate. It's an inadequate moral basis for a coercively backed decent minimum policy without a coherent theory of justice. A theory of justice doesn't imply a right to a decent minimum, on Buchanan's view. It does, however, imply the weaker claim that if there is a right, then that right is more limited than a right to than the right of strong equal access across the board. But, Buchanan says, special rather than universal rights to health care can be the basis of an argument for a decent minimum. So, rather than a universal rights claim, Buchanan argues that special rights claims can justify a decent basic minimum by restricting the right to certain individuals or groups. There are three types of arguments for special rights to a basic minimum of health care. First, rectifying institutional injustices. Blacks and Native Americans would be entitled to health care services due to unjust treatment by the government and social institutions, since these injustices have negatively impacted their health. So here we have an argument based on a theory of justice. Second, unjust harm. Another theory based on justice. This would allow for special rights to those who have suffered harm or exposure to health risk by private individuals or corporations. So environmental damage, pollutants, some of the government-sponsored experiments that we read about a few chapters ago in the human research chapter. These would be unjust harms, and based on that injustice, we could argue for special rights for those individuals. And finally, exceptional sacrifice. This would entail special rights to healthcare for those who have made exceptional sacrifices for the good of a society. This would include folks who have given military service, especially soldiers who have been wounded in combat. So here is one type of arguments from special rights, that are based in a coherent theory of justice that we can use to argue for a decent basic minimum without appealing to something as strong as universal rights to healthcare. Another type of argument that Buchanan gives is based on the principle of harm prevention. From this principle, the moral justification of services like immunization and sanitation are harm prevention. The justification here for a basic minimum is not an entitlement or even a special right, but based simply on the prevention of harm. There's a moral and likely a constitutional obligation, not right, but obligation, to achieve equal protection from harm. Thus, basic services should not vary across racial, ethnic, or geographical groups, and I might add other identity groups like LGBT or disability. Another type of argument that Buchanan gives is an argument based on prudence. A decent minimum of healthcare results in important social goods beyond healthcare itself. Things like keeping a healthy labor force, things like having a national defense. This depends upon some basic system of healthcare in a society. So, like harm prevention, these are utilitarian in nature, thinking about the consequences, but rather than emphasizing harm prevention, in the prudential arguments, we would emphasize the benefits, the rewards, the goods of having a system of healthcare in a given society. So this argument need not imply something like universal or even special rights, but simply that it results in better consequences for a society. And taking these arguments together, the special rights argument, the principle of harm argument, and prudential arguments, we can see that there's no need for an argument for universal moral rights to healthcare, which, as Buchanan has shown, is methodologically difficult. It's too strong a claim and difficult to enforce. He then gives some arguments based on enforced beneficence. Enforcement of a principle requiring a decent minimum is required for coordinated joint effort. So here he gives two arguments that are not about special rights, but they're directly from the principle of beneficence. He discusses two sort of rationales, both of which accept the premise that there is a basic moral obligation of charity or beneficence to those in need. As people, we should help other people when we can. Both rationales also accept that providing a decent minimum of healthcare is probably a more important form of beneficence than more minor individual acts of charity. Given these assumptions, these premises, he discusses two different rationales. First, we might use the rationale as individuals that enough others will contribute to the decent minimum to achieve a good outcome for society generally, so I don't need to contribute. Or people will think like me, and few people will contribute to the decent minimum healthcare, and the outcome won't be achieved, therefore I will have wasted my contribution. So I should not contribute to the decent minimum of healthcare and simply use my resources for a minor charitable act instead. That's one rationale. Another rationale that he thinks people will have would be that I'm willing to contribute to a decent minimum as long as others are willing to contribute as well in order to achieve a good outcome. Otherwise, I would be wrong to waste my resources when I could contribute to charity project A, B, or C. Without enforcement, I can't be assured that others will contribute. So this second one is more of an assurance problem. Neither is about self-interest, but merely the absence of enforcement is what undermines the effectiveness of the contribution based on beneficence. Achieving good outcomes in these kinds of public goods problems is always achieved through a kind of coercive mechanism, attaching penalties to non-contribution. Think taxes, think the Affordable Care Act and the penalties for not enrolling. This assures that others will also contribute, all for the public good. We use this kind of argument already. Tax laws that require contribution to national defense. This is a form of forced beneficence. The number of tax dollars that go to national defense is enforced by the government. Individuals are motivated not to contribute to the collective, so enforcement is necessary to overcome the individual motivation problem. This is the same thing with something like driving on the right-hand side of the road or following the speed limit. These are things that have to be enforced and coordinated in order to achieve well-being and public good. And on Buchanan's view, there may not be any right to something like a coordinated traffic system, but it is for our well-being. Just like voluntary charity, well-being and public good require enforcement. Beneficent individuals, then, cannot act in isolation. So, even if people have no rights to basic health care, there is a moral obligation to enforce principles requiring health care as a public good. Okay, so here we've seen two very different arguments. Daniels, who argues that there is a universal right to health care, and Buchanan, who argues, there's probably no universal right, but there are lots of arguments that show that we have a moral obligation to set up a basic minimum of health care as a form of public good.